Welcome to the Deep Dive. Today we're tackling a really fundamental area for anyone interested in healthcare and, well, how we keep people well-nourished. We're talking about nutritional components of patient care.
That's right. And we're drawing from a great resource, a detailed chapter from the Saunders NCLEX-PN Examination Review.
Think of this as your streamlined guide. We want to get to the core principles, the important guidelines, and, the crucial safety steps in nutrition for health.
Exactly. The aim is to give you a solid foundation without overwhelming you with absolutely everything. This chapter is really about equipping future nurses, so we've pulled out the key stuff for patient care.
Okay, sounds good. Let's jump right in with the basics. Nutrients. First up, carbohydrates.
Carbohydrates, yeah. They're the body's preferred energy source. You get about 4 calories for every gram.
4 calories, okay.
And they do more than just energy. They help with fat metabolism. They spare protein so it can do its building work. And they're really important for keeping your digestive system working well.
Right. And where do we find them mostly?
We'll think milk, grains, bread, pasta, rice, fruits, vegetables, the usual suspects. The chapter also stresses that not getting enough carbs can mess up other metabolic things in the body.
Makes sense. Okay, next. Fats. Fats get a bit of a bad rap sometimes, but they're vital, aren't they?
Oh, absolutely vital. Fats are super concentrated energy, like 9 calories per gram.
Wow, double the carbs.
Exactly. And there are stored energy. Plus, they cushion our organs, help maintain body temperature, and you need them to absorb certain vitamins.
Which ones were those again?
The fat-soluble ones, A, D, E, and K. You need fat to get those into your system properly.
Got it. And are there signs if somebody isn't getting enough essential fats?
Yeah, the chapter mentions a few things, like being really sensitive to cold, maybe some skin issues like lesions, getting infections more easily, and even for women, missed periods, amenorrhea.
Okay. But then there's the flip side, too much fat.
Definitely. High-fat diets are linked pretty strongly to obesity, heart disease, cardiovascular problems, and even some types of cancer. So, like with most things in nutrition, it's, all about balance.
Balance, right. Okay, moving on to proteins.
Ah, proteins. The building blocks.
That's what I always think of them as.
Precisely. Made of amino acids, they give you about 4 calories per gram, too, like carbs. But their main job is growth and repair of tissues, just incredibly varied functions.
Like what specifically?
Oh, building muscle, healing wounds, keeping fluids balanced, managing the body's acid-base balance, making antibodies for immunity, providing energy if needed, creating enzymes, hormones. The list goes on.
And there are different kinds of amino acids, essential and non-essential.
Exactly. Essential amino acids, those are the ones your body can't make, so you have to get them from food. Non-essential, your body can whip those up itself.
And complete versus incomplete proteins.
Right. Complete proteins, like from meat or dairy, have all the essential amino acids you need. Incomplete ones, often plant-based, might be low in 1 or 2, so you need to combine them smartly.
What happens if you don't get enough protein overall?
That can lead to serious issues like protein energy malnutrition. The body starts breaking down its own tissues, muscle wasting. It really shows how vital protein is.
Okay, so we've covered the big 3 macronutrients. What about the smaller guys, the micronutrients? Vitamins first.
Vitamins, yeah. Tiny but mighty. They don't provide energy directly, but they help unlock the energy from carbs, fats, and proteins. They're like catalysts for all sorts of body reactions.
Essential for life and growth, basically.
Absolutely, and regulating body functions. Now, there's that key difference. Fat-soluble versus water-soluble.
Right, fat solubles are A, D, E, and K.
Correct. And because they're fat-soluble, your body can store them in fat tissue, which is good, but it also means you can build up toxic levels if you take away too much over time.
And the others, B vitamins and C.
Those are water-soluble. Your body doesn't really store them long-term. Any excess, you generally just pee it out. Less risk of toxicity from food, but you need to get them more regularly.
The chapter has that box 11 to 1 with food sources. Can you give us a few quick examples? Like, where do we get folic acid?
Folic acid, think leafy greens, spinach, kale, also lentils, beans,
Niacin.
meat, poultry, fish, grains,
B1.
thiamine,
Pork, nuts, seeds.
B2, riboflavin.
Milk, dairy, lean meats.
Okay, B6.
Poultry, fish, bananas, potatoes.
B12 is the tricky one for vegetarians.
It often is, yeah.
Ah,
Mostly found in animal products, meat, fish, dairy, eggs.
vitamin C, easy one.
Citrus fruits, definitely. Oranges, lemons. Also bell peppers, strawberries, broccoli.
Vitamin A.
Liver, and those orange veggies like carrots, sweet potatoes. Think beta-carotene.
Vitamin D.
Fortified milk, Fatty fish like salmon and sunshine, of course.
Vitamin E.
Vegetable oils, nuts, seeds.
Okay,
Back to leafy greens like spinach and kale.
that's a great quick guide. Okay, what about minerals and electrolytes? Minerals are inorganic think elements. They're part of body structures, like calcium in bones and teeth.
And they help with reactions, too.
Yeah, they act as catalysts or enhancers for enzymes, and they're pretty much everywhere in food, which is good.
But deficiencies can still happen, especially in hospital settings.
Definitely. Chronic illness, being hospitalized, it puts people at higher risk. Electrolytes are a special type of mineral.
The ones with electrical charges.
Exactly. When dissolved in water. Crucial for balancing fluids, osmolality, water regulation, acid-base balance, enzyme reactions, and nerve and muscle activity. Chapter 8 goes deeper on just electrolytes.
Box 11-2 has sources for these too. Quick hits, calcium.
Dairy, obviously. Leafy greens, too.
Let's go.
Table salt, sodium chloride.
Iron.
Red meat, spinach, beans, lentils. For oxygen transport.
Magnesium.
Nuts, seeds, dark leafy greens, involved in tons of reactions.
Phosphorus.
Dairy, meat, whole grains, bone health, energy.
Potassium.
Bananas, potatoes, lots of fruits and veggies. Nerves, muscles. Processed foods, table salt, blood pressure connection.
And zinc.
Meat, poultry, seafood, beans, immune function, wound healing.
Okay. The chapter also makes a point about practical nursing stuff related to eating.
Yes, super important. Always check if the patient can actually swallow safely. That's priority 1.
Dysphagia screening.
Right. And then encourage them to eat independently as much as they can. It's good for their dignity, their intake, everything.
And our needs change over life.
Yeah.
Right. Nutrition isn't static.
Absolutely not. Pregnancy, lactation, huge demands. Infancy, childhood, adolescence periods of rapid growth. Then adulthood, and especially older adulthood, where aging changes how we process nutrients, all have specific needs.
Yeah. Solid foundation on nutrients. Now, how do we put it all together? MyPlate comes up next.
Yeah, MyPlate. You've probably seen it. Figure 11:1 in the book, or choosemyplate.dev. It's that visual guide, the plate divided into sections.
Grains, vegetables, fruits, protein, and dairy off to the side.
Exactly. It gives you a visual target for balancing those food groups.
But it's just a guide, right? Individual needs vary a lot.
Hugely. That's why consulting a registered dietitian or nutritionist is so important for personalized advice. Health conditions, activity level, age, it all matters.
What are the key takeaways from the MyPlate guidelines mentioned?
Well, things like portion control, just being mindful of how much you're eating. Making half your plate fruits and vegetables is a big one.
Variety, too, right? Not just potatoes and bananas.
Definitely variety. Aiming for whole grains for at least half your grains. Choosing low-fat or fat-free dairy. Lean proteins.
And less processed stuff.
Yeah, favoring fresh foods over heavily processed ones. And drinking water instead of sugary drinks. Pretty common sense stuff, but good reminders.
And crucially, respecting individual choices.
Absolutely critical. You have to consider culture, spiritual beliefs, personal preferences. Nutrition plans only work if people actually follow them.
Okay, now for the big section.
Yeah.
Therapeutic diets. These are for specific medical conditions. Let's start with a clear liquid diet.
Right. Clear liquids. Think fluids and electrolytes. That's the main goal. Preventing dehydration.
What would you use this?
Often it's the first step after someone's had complete bowel rest, maybe post-surgery. Or if they're severely malnourished and just starting intake, bowel prep before procedures too.
Or if they have like really bad vomiting or diarrhea.
Exactly. Fever, gastroenteritis. But the key thing for nurses to remember is that this diet is seriously lacking.
In calories, nutrients.
Both. It's easily digested, minimal residue, but definitely not nutritious long-term, and frankly kind of unappetizing, so short-term only.
What counts as clear liquid?
Water, bouillon, clear broth, carbonated drinks, plain gelatin, hard candy, lemonade without pulp, ice pops, plain coffee or tea, usually limit caffeine. Sugar and salt are okay.
Without.
Dairy, definitely, and any uses with pulp. And you have to monitor hydration really closely, intake, output, weight changes, signs of edema or dehydration. Remember that 1 kilo weight change is about 1 liter of fluid.
Good point. Okay, step up from clear liquids.
Yeah.
Full liquid diet.
Yep, full liquids. Often the transition step. Also for people with chewing or swallowing problems who can't handle solids yet.
Still potentially lacking in nutrients, though.
It can be, yeah, especially long-term. It includes everything from clear liquids, plus things that are liquid at body temp but might be opaque.
Like milk.
Ice cream. Exactly. Milk, ice cream, sherbet, breakfast drinks, pudding, custard, strained soups, strained juices, even some refined cereals like cream of wheat if they're thin enough.
But if someone's on this for more than a few days?
Then they usually need nutritional supplements like Ensure or Boost, maybe specific protein supplements prescribed by the doctor to make sure they're getting enough calories and nutrients.
Makes sense. Then mechanical soft. Sounds like texture is the key here.
Texture is absolutely the key. It's for people who have trouble chewing, maybe dental issues, post-surgery on head neck, sometimes dysphagia, though they'll need that swallow evaluation first.
And the liquids might need thickening for dysphagia.
Correct. To prevent aspiration. Mechanical soft means the food's consistency has changed. Pureed, mashed, ground, finely chopped, easy to manage with minimal chewing.
What kinds of foods are usually avoided?
Things that are hard to chew or manage. Nuts, dried fruit, raw fruits and veggies, fried foods, tough meats, things with seeds or coarse textures, chocolate candy sometimes too.
And how does the soft diet differ? Sounds really similar.
It is very similar, often used interchangeably or as a slight step up. Also for chewing, swallowing issues, maybe mouth sores, jaw problems, post-stroke.
Any specific nursing tips for the soft diet?
Cooler temps can be soothing for mouth sores. Sour candy might help stimulate saliva if their mouth is dry. Encourage variety, offer fluids with meals. Straws can be tricky with dysphagia aspiration risk.
Seasons are okay.
Usually, yeah. The main thing is the soft consistency. Avoid the same hard-to-chew stuff. Nuts, seeds, raw produce, fried foods, coarse whole grains.
Okay, let's talk fiber. Low fiber first, also called low residue.
Right, low fiber or low residue. The goal is to decrease the bulk in the stool and slow transit time.
Why would you want to do that?
If the intestine is narrowed, maybe from inflammation like in IBD Crohn's or ulcerative colitis or scarring, partial obstruction, severe diarrhea, gastroenteritis, basically situations where you want to give the bowel less work to do.
What foods fit this?
Things like white bread, refined cereals, Rice Krispies, cornflakes, potatoes without skin, white rice, refined pasta.
This limited or avoided?
Most raw fruits, except maybe bananas. Most vegetables, nuts, seeds, whole grains. Dairy is often limited to maybe just 2 servings a day.
And the opposite, high fiber.
High fiber or high residue. This is optimal for constipation, some types of IBS, especially constipation predominant or alternating types, and diverticular disease when it's not inflamed.
How much fiber are we talking?
Usually aiming for 20 to 35 grams a day. Fiber adds bulk, holds water, and speeds things up.
This is lots of free.
Fruits, vegetables, whole grains. But the key is to increase fiber gradually.
Why gradually?
To avoid side effects like cramping, bloating, gas, diarrhea, and you absolutely need enough fluids with high fiber, or it can actually make constipation worse. Dehydration is a risk too. Box 11-3 lists gas-forming foods that might need limiting.
Okay. Next, the big one. The cardiac diet for heart health.
Yes, very common. Box 11-4 often details specifics. It's used for atherosclerosis, diabetes, high cholesterol, high blood pressure, after heart attacks, even some kidney issues like nephrotic syndrome or kidney failure.
The goal is reducing heart disease risk.
Exactly. The dietary approaches to stop hypertension is a prime example. Lots of fruits, veggies, whole grains, low-fat dairy, lean protein like fish and poultry, nuts, beans.
What's restricted?
The big ones are total fat, especially saturated in trans fats, cholesterol, and sodium. Limiting sugary drinks, red meat, added fats too.
Okay. Then there's a specifically fat-restricted diet. How's that different?
While the cardiac diet restricts fat, a fat-restricted diet is usually more focused on managing symptoms related to fat digestion. Abdominal pain, steatorrhea, that's fatty stools gas, diarrhea caused by high-fat intake. Also for conditions where fat isn't absorbed well, like malabsorption syndromes, pancreatitis, gallbladder disease, sometimes GERD.
So it restricts all types of fat.
Generally, yes, the total amount. And with malabsorption, people might also have trouble with fiber and lactose, so those might need adjusting too.
Any risks with restricting fat so much?
Yeah, potentially vitamin deficiencies, especially those fat-soluble ones, A, D, E, K, and maybe mineral issues if there's ongoing diarrhea or steatorrhea. A fecal fat test can help diagnose malabsorption.
Okay, what about diets designed to increase intake? High calorie, high protein.
Right. This is for people with really high nutritional needs, thanks severe stress from illness or injury, major burns, cancer, HIV/AIDS, COPD, respiratory failure, conditions that really deplete the body.
So the focus is nutrient density.
Exactly. Foods high in both calories and protein, whole milk, peanut butter, nuts, seeds, meat, poultry, fish, eggs. Encouraging snacks is key too. Milkshakes, supplements like Ensure, instant breakfast drinks. Sometimes calorie counts are done to track intake.
Then there's the carbohydrate-consistent diet. for managing blood sugar.
Precisely. Primarily for diabetes, but also hypoglycemia or hyperglycemia, sometimes obesity. The main goal is consistency in carb intake throughout the day.
How do people track that?
Often using the exchange system, which groups foods by carb, protein, fat content, or carb counting, literally tracking grams of carbs per meal. MyPlate can also be a helpful guide here.
Sodium-restricted diet, we touched on this with cardiac, but it's its own category too.
Very important. Box 11 to 4 again. Used for hypertension, heart failure, kidney disease, liver disease. The level of restriction varies a lot.
From just no added salt to really strict.
Exactly. It's individualized. The big advice is always fresh over processed. Canned, frozen, instant, smoked, pickled, boxed foods, lunch meats, soy sauce, dressings, fast food, soups, they're often loaded with sodium.
Even some medications.
Surprisingly, yes. Some meds have sodium. And salt substitutes need caution, especially with kidney disease, because they often contain potassium.
Which leads nicely into potassium issues. But first, protein restriction for kidney and liver disease.
Right. Renal disease, end-stage liver disease. The goal is tricky. Enough protein for nutrition, but not so much that waste products build up because the kidneys or liver can't handle them.
How much protein are we talking?
Often around 40 to 60 grams a day, but it needs careful assessment, especially if they're critically ill and losing protein. Quality matters. Too high biological value protein is best.
And getting enough calories from other sources is key.
Crucial. Need enough energy from carbs and fats to spare the protein. There are special low-protein products available, like pastas and breads. You even have to watch protein in fruits and veggies on very strict diets. Milk, meat, bread, starches are usually limited.
Okay. Gluten-free diet, pretty self-explanatory now.
Yeah, for celiac disease or gluten sensitivity. Eliminate wheat, barley, rye. Chapter 30 covers it more.
And the overall renal diet, it combines several restrictions.
It does. It's complex. Usually controls protein, sodium, phosphorus, calcium, potassium, and fluids. Maybe fiber, cholesterol, fat, too.
Dialysis affects it.
Yes. Peritoneal dialysis patients often have slightly less restriction on fluid and protein than hemodialysis patients. Fluid restriction is common, though, and box 11 to 5 has tips for managing thirst, like sucking on ice chips or hard candy.
Okay, back to potassium. Potassium-modified diets. Low potassium 4.
Hyperkalemia, high potassium, can happen with kidney problems, certain hormone issues like Addison's, or medications like ACE inhibitors, some immunosuppressants, potassium-sparing diuretics.
And high potassium 4.
Hypokalemia, low potassium.
How is that
Causes include some kidney issues, GI losses, vomiting, diarrhea, shifts into cells, potassium-wasting diuretics, some antibiotics, Cushing syndrome.
Box 11 to 2 lists foods high and low in potassium.
Yes, it's the go-to reference. Low K examples are things like applesauce, green beans. High K includes bananas, potatoes, spinach, oranges.
High calcium diet. For bones, mostly.
Primarily, yes. Bone growth, preventing osteoporosis. Also needed for muscle contraction, nerve signals. Dairy is the main source, but need non-dairy options like fortified foods or leafy greens for lactose intolerance. Box 11 to 2 lists high calcium foods.
Low-purine diet. For gout.
Gout, yes. Also certain kidney stones or just high uric acid levels. Purines break down into uric acid.
So avoid high purine foods. Like
anchovies, sardines, herring, mackerel, scallops, organ meats like liver, gravies, meat extracts, wild game, goose, sweetbreads.
And lastly, high iron diet for anemia.
Exactly. Iron deficiency anemia mainly. Need to replenish iron stores.
Good sources.
Organ meats again. Red meat, egg yolks, whole grains, dark leafy greens, dried fruit, legumes.
And take it with vitamin C.
Yeah, helps absorption significantly. Orange juice with your iron-fortified cereal, for example. And always check for allergies and food-med interactions first.
Wow, that was an incredibly thorough tour of therapeutic diets. Okay, let's shift gears slightly. What about vegan and vegetarian diets? These are choices, not usually prescriptions.
Exactly, client choices. Vegan is the strictest only plant foods. Grains, legumes, nuts, seeds, fruits, veggies. Soy is important here.
Lacto-vegetarian.
Allows dairy, but no meat, fish, poultry, or eggs. Can be balanced with variety.
Lacto-ovo-vegetarian.
Allows dairy and eggs. No meat, poultry, fish. Generally pretty nutritionally found with a variety.
Ovo-vegetarian.
Just eggs from animal sources. Eggs are a complete protein.
What are the nursing considerations for clients choosing these diets?
Well, first, respect the choice. Then, ensure they're getting enough variety for all nutrients and energy. Education on complementary proteins is key for vegans especially.
Potential deficiencies to watch for?
Yeah, energy, maybe protein depending on planning. Vitamin B12 is a big one for vegans. Zinc, iron, calcium, omega-3s, maybe vitamin D if they don't get sun or fortified foods.
And that tip about vitamin C with iron applies here too.
Definitely helps boost absorption of plant-based iron. Common foods you'll see are tofu, tempeh, lots of beans and lentils. Soy protein is actually quite comparable to animal protein nutritionally.
Okay, now, what if someone can't eat enough by mouth? Enteral nutrition is an option.
Yes, enteral nutrition, or tube feeding, delivers liquid formula right into the GI tract via a tube.
When is this used?
When the gut works but oral intake isn't enough. Swallowing problems, burns, trauma, organ failure, severe malnutrition. If they're lactose intolerant, use lactose-free formulas to avoid GI upset, diarrhea, bloating. Chapter 18 goes into the details of tubes and administration.
And if the gut doesn't work,
Then you move to parenteral nutrition, or PN, feeding through the veins.
also called hyperalimentation or TPN.
Right. TPN, total parenteral nutrition, provides everything. PPN, parenteral nutrition, is often partial or shorter term. It supplies dextrose, carbs, fats, amino acids, protein, vitamins, minerals, electrolytes, water, bypasses the gut entirely, prevents catabolism, body breaking down muscle. These solutions are hypertonic, very concentrated.
Why would someone need PN?
Severe gut dysfunction, basically, non-functional gut. Maybe after multiple GI surgeries, severe intolerance to tube feeds, obstructions if the bowel needs complete rest. Also severe malnutrition, like in AIDS, cancer, burns, or during intense chemo. It's usually the last resort when oral or enteral routes aren't feasible.
How is it given? Central line versus peripheral.
PPN can sometimes go through a large peripheral vein in the arm, or a midline, or a PICC line. TPN, because it's so concentrated, usually needs a central vein, subclavian, jugular. A PICC that ends in a central vein is okay too.
What if the PN bag runs empty unexpectedly? Big risk.
Huge risk of hypoglycemia, low blood sugar because of all the dextrose. You must hang a bag of 10% dextrose solution at the same infusion rate until the new PN bag arrives. Critical safety point.
And for peripheral PN, watch the IV site carefully.
Absolutely. Look for sclerosis, hardening, phlebitis, inflammation, swelling. It can be irritating to smaller veins.
The chapter mentions fat emulsions or lipids separately. Why?
Lipids are a key part of PN for many patients. They provide calories, prevent fatty acid deficiency. They're isotonic, so less irritating, can go peripheral or central.
What are they made of? Any allergy concerns?
Usually soybean or safflower oil with egg yolk phospholipids as an emulsifier. So egg allergy is a definite contraindication. You need to check that.
Benefits of using lipids.
Can help control blood sugar, especially in diabetes, reducing the need for high insulin doses sometimes needed with high dextrose PN.
How do you handle them?
Inspect the bottle carefully. No separation or frothiness. If it looks off, don't use it. Nothing else gets added to the lipid bag itself. Monitor vitals closely when starting, especially the first 30 mins every 10 mins. Watch for reactions. Box 11 to 6 lists them. Stop immediately if a reaction occurs. Notify RN provider. Serum lipids might be checked 4 hours after infusion.
Besides the main macros and fats, what else goes into PN?
Oh, lots of vital stuff. Vitamins to prevent deficiency. Minerals and trace elements for metabolism. Electrolytes, adjusted based on labs. Water for hydration. Insulin might be added directly to the bag for glucose control. Sometimes a little heparin to prevent catheter clots.
Okay, PN is clearly high risk. What are the major complications and nursing considerations? Table 11-1 probably covers these.
Definitely high risk. First, always double-check the PN solution against the order. 2 nurse check often required. Absolutely no other IV meds or blood through the PM line, high risk of infection and incompatibility. Monitor coagulation labs, PTT, PT, if they're on anticoagulant.
Regular labs are crucial.
Essential. Electrolytes, albumin, liver function tests, kidney function tests, BUN, creatinine. Albumin might dip initially if they were dehydrated. That's expected.
What's refeeding syndrome? Sounds serious.
It is very serious. Happens in severely malnourished folks when you refeed too quickly. Electrolytes plummet, potassium, magnesium, phosphate. Watch for shallow breathing, confusion, weakness, bleeding, seizures. Report immediately.
What if liver or kidney tests get weird?
Abnormal liver function could mean issues with the fat emulsion or glucose-protein metabolism. Abnormal kidney function might point to too much amino acid load.
How about handling the PN bags?
Keep refrigerated, take out only 30-60 minutes before hanging, use within 24 hours of prep. Never use if cloudy or darkened, return to pharmacy. Only pharmacy adds things to the bag, and regular dietitian consults are key.
How do you safely stop PN therapy? Can't just pull the plug.
No, definitely not. Risk of rebound hypoglycemia. Needs evaluation by dietitian first. Then you wean it off gradually, usually over 1-2 hours, while increasing oral or enteral intake.
What happens after the line is out?
Sterile dressing on the site, change daily till healed, keep encouraging oral intake, monitor their intake, weight, electrolytes, glucose closely to ensure they're managing okay off the PN.
What about patients going home on PN? Box 11-7 has instructions.
Yeah, extensive teaching needed. How to manage the infusion, pumps, sterile dressing changes, daily weights, same time, same clothes, report gain over 3 pounds a week, could be fluid overload, blood glucose monitoring if needed.
And recognizing complications.
Critical. Teach signs of infection, redness, drainage, fever, thrombosis clot, arm swelling, neck pain, JVD, air embolism, sudden shortness of breath, chest pain, catheter displacement, leaking, pain on infusion. They need to know what to look for and when to call immediately. Stress, follow-up care, keep pumps charged.
Okay. The chapter includes a critical thinking scenario, too, about thirst.
Right, page 123. Client with kidney injury, fluid restriction, really thirsty, what do? The answer highlights comfort measures. Chewing gum, hard candy, freezing allowed fluids, lemon and water, refrigerated mouthwash. It's about balancing medical needs with patient comfort and finding ways to help them cope with restrictions.
Good practical stuff. And it lists references for more reading.
Yes, DeWitt and Swearingen are mentioned for further study.
Okay, let's wrap up with those practice questions. Quick fire. Question 71. Blood clotting problems suggest needing which nutrient found in what food?
Blood clotting, vitamin K, green leafy vegetables, answer 4.
Correct. Question 72. IBS with constipation diarrhea. What helps?
Fiber helps regulate, so fruits and whole grains, options 2 and 5. Need to be careful with gas formers, though.
Right. Question 73. Lacto-vegetarian gets a tray. What doesn't belong?
Lacto, dairy, okay. No eggs, so remove the eggs. Answer 1.
Yep. Question 74. Low-sodium diet understanding. Which choice is good?
Baked turkey is likely lowest sodium. Soup, shrimp, gumbo can be high, so answer 1.
Got it. Question 75. Client with gout. Avoid which food?
Gout, avoid high purine. Scallops are high purine. Answer 1.
Perfect. Question 76. Gastroenteritis. Clear liquid diet. What's allowed?
Needs to be clear, easily digested, fat-free beef broth fits. Answer 4.
Question 77. Low-fat diet. What to avoid?
Cheese is usually high in fat compared to the other options. Answer 2.
Question 78. Good source of riboflavin. B2.
Milk is a classic source. Answer 1.
Question 79. Burn patient needs protein and vitamin C for healing. Best meal combo.
Need both protein and Vit C. Chicken protein, broccoli, Vit C, strawberries. Milk protein. Answer 2 looks best.
Excellent. Last one, question 80. Low sodium teaching. What statement shows misunderstanding?
The idea that fresh fruits and vegetables are high in sodium, that's wrong. They're generally low. So statement 2 needs correction.
Fantastic. Well, that really wraps up an incredibly thorough deep dive. We've gone from basic nutrients all the way through complex therapeutic diets and intravenous feeding.
Yeah, we covered a lot. The goal was really to pull out the most critical nursing concepts, the safety points, the key assessments from that Saunders chapter, making it digestible, hopefully.
Absolutely. So as you, our listener, think about all this, maybe consider how these nutritional principles touch your own health or the choices people around you make. It's fundamental stuff.
It really is. And just to confirm for everyone, we have now gone through all the key material presented in Chapter 11, Nutritional Components of Care, from the 7th edition of the Saunders Comprehensive Review for the NCLEX-PN Examination. Complete coverage.